Initial assessment of patient visited to OP, IP, and emergency. What is the difference? So, initial assessment should be taken at each point. If the patient is visiting to OP, initial assessment is required. Patient visitor admitted in the IP, it is required to be done the initial assessment. Patient when visited to emergency also initial assessment is required. Initial assessment is the first clinical evaluation. When patient came, what is the patient status? That is the initial assessment. NABH is not asking the same things or in depth you do everywhere, every component to be taken care as the initial assessment. No, right assessment should be done in the right place. What is the requirement in the OPD? In the OPD, present complaint should be the relevant history, your vital sign, your provisional diagnosis, your plan of care, nutritional assessment. And the OPD, your doctors will do the initial assessment and vitals will be recorded by the nurses, and nursing initial assessment, doctor's initial assessment should be different, and it should be signed by both, and the date and time should be there. Signature with date and time mandatory. But what is requirement in the IP? In IP, detailed history and physical examination will be taken care by the resident doctor or by the consultant. Anything is fine. Vital signs to be recorded, initial diagnosis, any present medications, order any investigations, treatment plan, special needs, pain assessments to be done. Then your nursing assessment and doctor assessment should be separate. Initial assessment in IP, one sit for the nursing, one sit for the doctor's assessment. In nursing assessment, your pressure ulcer should be there, assessment should be there, fall assessment should be there, pain assessment should be there, your vitals, your treatment plan, your plan of care, and along with the patient signature and the nursing signature should be there. And in the doctor's initial assessment also, the patient should sign and the doctor should sign and the treating consultant should sign within 24 hours. So this is the requirement in the IP initial assessment. In nursing assessment, a patient signature is not required, but the patient signature is required in the doctor assessment. So the patient signature, why is the required? Because patient is giving the consent that they have provided their history. So for that reason, the patient signature is required. Patient or attender who is providing the their details of their present illness. So that person should sign, and the whoever has taken the uh, assessment, that doctor should sign, and the treating consultant should sign within 24 hours. And date and time is the mandatory